everyone. Welcome to Optimism's Peak. My name is Shanique. This is a podcast where you would hear conversations that will help you grow professionally, personally, and mentally. Again, my name is Shanique, and I am an optimist. I'm an entrepreneur. I'm a bunch of things. So today we have a special guest. We have Neka M. She is a licensed nurse. She has a wealth of information, a wealth of experience. So welcome, Neka. I'm so happy that you're here.
Thank you. Thank you for having me.
Yeah. So my first question for you is, can you tell us a little bit about, why you've gotten into nursing or how you got into the nursing field and your experience in nursing so far?
Yeah, so I know it's cliche to say, but I actually like helping people. So in that, I found myself in nursing. So I finished my LPN and I started off working in assisted living and nursing home. And to broaden my knowledge of my skill, I started moving over to med surg. I've done primary care, I've done women's health, GYN. And for the last 4 years, out of 8, I have been in hematology oncology, where I do chemo and venous access. So yeah, I've had a breadth of knowledge in nursing of all areas, of mostly all areas. But I have a lot of my experience in oncology, helping cancer patients.
Okay, very nice. So can you tell us a little bit more about this area of contracts? I see that more and more people are talking about nursing contracts. I don't know if they've recently gotten popular, if they've been popular, or if the pandemic was the onset of that. Can you talk a little bit more about contracts and kind of a generalization of what they are?
Yeah, well, contracts have always been around because there's always been a nursing shortage and there's always been this need to fill these positions temporarily until they get permanent people, in which you're hired by a third-party company, an agency, to fulfill the need of a hospital or clinic or whichever facility may need you. So contracts have become very popular since the pandemic because, during the pandemic, we lost a lot of nurses who were on the front line. Shout out to all the nurses that were on the front line who were dealing with COVID and helping. You guys rock. We lost a lot of people left the field, a lot of people, lost their lives. And that's where contracts got its popularity, because we needed people to respond rapidly to a crisis. And since then, everyone is just talking about contracts and jumping on the wave of contracts as a form, or traveling as a form of nursing experience. So to explain what a contract is, basically a facility needs a person, right? They cannot hire a person for whatever reason, whether their ad is not getting enough clickbait and enough attention, whereas the need is not being filled. So what they do is they start an agency, and they come to this agency and they're like, hey, we need a nurse. That agency then puts an ad up and you work through this agency for a specific length of time in whichever field or whichever specialty they need you in. And it's a contract, right? It specifies a certain length of time you work. It specifies how much you get paid and where you'll be working, and you guys negotiate it out and you go work for a specific amount of time, and you either stay on for longer or you go to another agency or another contract.
Okay, how does a nurse find a contract? Is it as simple as doing a Google search, or?
It is as simple as doing a Google search. Since the pandemic, it is so popular. You can literally type in contract nurse and it pops right up with a slew of agencies that you can work with. and it will basically give you the breakdown of how to jump on with these different companies and what they require of you to start.
Okay. Are there like popular nursing contract agencies like that are more, reputable than others, or does it depend on what region you're in?
I feel like I wouldn't say more reputable, but I would say more popular. Mm-hmm. Some agencies are a lot more popular than others. It doesn't depend on the region. Just some people just gravitate to certain agencies because their name is more popular. And with the name popularity, it's more trust, right? Because if everybody knows this agency, you're more likely to feel trust going and doing a contract across the United States with them because you feel like you're going to be in good hands.
Okay. What are some, if you don't mind saying, like, what are some agencies that you think are, what are some agencies that are actually popular? I wouldn't even say like in your opinion, but like what are some big ones out there?
Okay. Total Med is a really big one. I like Total Med. Pros of Total Med, they are across the United States. So you can get contracts in all 50 states. Their pay is pretty good, is pretty competitive. They're quick to respond. And although I have never worked with Total Med because I have never been able to secure a contract to my liking with them, I do have nursing colleagues who have had really good experience with Total Med. And an agency that I frequent is Aya. Aya has come under some fire in the media, but I still stand behind Aya Healthcare because I have worked several contracts with Aya, and they are one of the most attentive. They are one of the most responsive agencies that I've worked with, and I've been working with about a good 3 or 4 agencies. And I feel like although the media may say something different, I find them to be very transparent. My onboarding process was the best onboarding I've had. Mind you, this is not sponsored. I like Aya personally. Okay. It seems like everybody does. That's one of the more popular ones. But just to name a few, I like those two. I tend to stick between those.
Okay, so I don't even know where I want to head with this, right? Because on one end, I really want to talk about negotiation, but on another end, I actually want to talk about those girls who can't travel, right? And, people who have responsibilities who can't really travel, who think that, contract nursing is not for them. Can you speak a little bit about like local contracts and how beneficial they are, or if they are beneficial, or if they are worth it?
Right. So I don't know about in everyone's state, but in the state that I am in, local contracts are a thing. Most agencies will offer you what's called a blended rate. Well, let's start with breaking down how contracts work, right? You will get a contract, and contracts are broken down by, they give you a taxable rate, they give you an untaxable stipend, whereas that's an amount of money that you are guaranteed as long as you work a certain amount of hours, and that will be stipulated in your contract. Like, they will tell you that the amount of hours you have to work to qualify to get that untaxed stipend. It also comes with a meal and lodge stipend as well. And they will also give you your breakdown of your overtime rate, or time and a half rate, or a callback rate, meaning the facility, you went home, you fell asleep, and the facility is like, hey, can you come back? We're still short. You get paid a separate rate for that. And all of that together will come up to a total weekly rate. And that can be anywhere from $1,500 a week up to, $5K a week. That's the numbers that were being seen during the pandemic. But that rate varies and fluctuates depending on the need, depending on the state. Now, when you go local, you don't get the same breakdown because it's called a blended rate. What they will do is they will take all of those incentives and they will do a calculation and give you a number, which is called your local rate, which is a per hour rate. It's an hourly rate. And that's how your local contract rate will be broken down. And that's the amount that you will be paid. Now, the trick to that is in some states, these contracts are far. Some contracts can be 20 miles away. Sometimes it's 30 miles away. And unfortunately, that's where most of the higher paying contracts will be. And the benefit of that is once you work a certain distance, some companies require 30 miles, some companies require 50 miles, you qualify for that stipend. You qualify for that lump sum of money where you get that guaranteed untaxed per week, which means it gives you a higher take home because that amount of money is not being taxed off the front end. So to me, I like both. And when you're local, I should say this first. When you're local, you can do either. It doesn't necessarily mean because you're local, you can't take this 50-mile away contract. You're still considered a local contract. Also, you may have a facility that's 5 miles away from you, and you can do that blended rate. And the glory of it is you set the terms of how you work. You set the terms of how many weeks you work. You set the terms of what days you would like to work. If you need any days off to vacation, or you have a doctor's appointment or some events coming up, those are called blackout dates, and they cannot schedule you on those dates. So it just gives you a lot more freedom and flexibility with scheduling and work-life balance. So I like local contracts for the people who can't travel, who have children, or who feel like they are tethered to a certain location, because you get all the perks and the pay of a travel contract, but you're local, and it still gives you the same amount of freedom as people who are able to go a little further.
Nice. Thanks. That's really, really helpful. Can you talk a little bit about negotiation and negotiating your contracts? I know that some people probably take what's given to them, but can you just speak to the amount of power that you have to take control of your own contract?
Sure. So when you with any employment, I feel like if you know your worth is more than what they are offering, you should always counter. And it goes with contracts as well. You should always counter if you feel like you're being lowballed on the rate. And you have to take into consideration if you're a local contract and they're offering you a rate that is closer to what you would have been staff, you have to either negotiate it or you have to consider, is this worth me traveling? Because if you're going 10 to 15 or even 20 miles away, you have to pay for gas. That's time, that's mileage on your car, that's wear and tear you have to pay for on your car. That's either if you're not driving and you're taking transportation, that's transportation money, that's time that you're spending traveling. You have to take these things into consideration when they offer you a rate. And if you feel like that rate is not reflective of your experience, the amount of time and effort that you're putting into getting to and from your contract, in the amount of miles on your car, the repairs you're going to have to make on your car, and the gas you're going to have to spend per week, then you should definitely negotiate. And when you're negotiating, you mention all those things. You be transparent. You say, hey, I need to know if this rate can come up a little bit, because these are the factors that are playing into me not being able to take this contract at where it is. And if it's just based on your experience and you have the experience to get paid more, play up your experience. Tell them I have 4 or 5 years as a nurse in this area, or I have this in this area. And don't be afraid if they say no. That doesn't mean it's the end. It's so many contracts out here. It is literally thousands of contracts. And the glory of contracts, listen up, nurses, the glory of contracts are not one company holds one contract. So you may see your favorite hospital with one particular company, and you're like, hey, I don't feel like this is reflective of my experience. And they're like, nope, we're not budging on our pay. You can literally go look at other companies, and 9 times out of 10 other companies will have your same contract posted, and you get to basically rate shop between companies and see who is going to offer you the most competitive rate, and take it from there, and who's also going to be more flexible with the rate to get it closer to what you feel like you should be paid. And sometimes if you're in Target and you want to use, Walmart sells it for this price, you can kind of do that with the agencies on contracts. You could be like, hey, company XYZ over here is offering a whole $10 more than you. I can show you the rate. Why would I take this contract for this rate and this company is definitely offering me more money? And sometimes that works because they want to be competitive with the other companies to basically book you as their talent. So those are some tips and tricks you can use to kind of negotiate your contract, and also look for a contract that is going to pay you the most bang for your buck.
Yes. And it also looks good to them, right? That they're able to fill the position versus company XYZ. So it's a win-win for everybody. So
exactly.
Know your worth.
Know your worth. And negotiate it likewise.
Yes. Okay. I think, because I'm not a nurse, I feel like I'm missing a question. But anything else you can think of, like just to kind of like round up this conversation on contracts? What about for other nurses, other types of nurses? Is it just for LPNs? Is it just for RNs?
Absolutely not. Okay. Absolutely not. They have contracts for medical assistants. They have contracts for phlebotomists. They have contracts for laboratory technicians. They have contracts for CNAs. There are administrative role contracts. They have director of nursing contracts. Like, there are a slew of contracts out there. If you feel like you're tired of sitting in one place, you need a little bit more flexibility. Either you just want to not be tethered to a company, and you want to just be a free agent and just work at your leisure for a certain amount of time and have the power to be like, I want to take a couple of months off and then go back to it, then that's what you should do. No matter if you're a CNA, an LPN, an RN, an NP, a DON, a medical assistant, a lab tech, anybody can go and join a contract. Either local or travel is open. Healthcare is very vast. I think the pandemic has showed us how much we need it, although I do feel like nurses still aren't as valued as we should be. I do feel like the pandemic has highlighted how much of an asset we are and how much we are needed to quality healthcare. And in that, traveling is the new wave of nursing. I would say it's a lot harder for a new grad to get a contract. They are a little reluctant, I wouldn't say not willing to give you a contract because of your lack of experience. And to the new grad nurses or new grad lab techs, I would say play up your strengths, go in confident, go in sure of yourself, and sell yourself in these interviews, and just show them that although you are new, you still know your skill, you're still able to perform the job just like any other nurse on the floor. And don't take no, keep going. Somebody's gonna offer you, and that's how you can get your experience. I would just say it's a bunch of agencies, guys. It's a bunch of ways to do it. I feel like just hop on a train, come over to the dark side.
So just do your research, guys, and make sure you're looking around and just being diligent about like what you're finding, because you don't want to shortchange yourself either. All right, so I have a question for you. Mm-hmm. If you can go back to yourself, let's say to you, not 15, let's do 10 years ago. If you could go back and tell yourself something, right? You today, like give yourself any advice or say anything to yourself from 10 years ago, what would you say?
If I could say anything to myself 10 years ago, I would say to not be so hung up on how it gets done, but to just do it. Because 10 years ago me was a perfectionist, and I felt like in order for it to be done or to get done, especially being a nurse, it had to be the perfect way that I envisioned it. And it had to be, I graduated at 20 because of the age that I went into college. I would have graduated at 20 and finished my BSN online. I would have graduated with my ADN and finished with my BSN, and I would have been a 21-year-old nurse, and I would have been young. And because it didn't work out that way, the perfect way, it kind of made me get discouraged with being a nurse. And I feel like that delayed me in getting to where I am now. I feel like don't do that to yourself. Just get it done.
Yeah.
Just go in and get it done. And it doesn't have to be perfect, whether you start off as a CNA to a medical assistant to an LPN to an RN, or if it's just LPN to an RN, however you get there, get it done. And don't ever let anybody tell you you're less of a nurse than somebody else because of your title, because you still know your skills. You still learned your assessments. You still know your stuff while you're working, and you have to be confident and walk with confidence in that. And I think those are the main things I would tell my 10-year-old. So
yes, that's so good. All right. Any questions for me?
No, not at the moment.
Okay. That's a first.
I know, right?
Wow.
I always have a question.
Always, yeah. So if you guys are like, for all the listeners out there, me and Neka know each other very well, a little too well. I think we're like related or something.
Way too well.
Yes. Well, thank you so much for coming and talking to the people today and giving them so much good knowledge and so many good tips on like just another area of nursing and another avenue that they can go in, especially if they feel burnt out, especially if they want to take more control over their career. I appreciate you being here.
Thank you. Thank you so much for having me. Yeah. I appreciate the platform and being able to just give nurses and healthcare workers in general more insight on something that's new to a lot of people and could be a lot intimidating to navigate.
Yeah, definitely. Okay, so that's it for today's episode. Thank you so much for listening to Optimism's Peak. I hope everyone is a little bit more optimistic after hearing this. Neka, did you want to give them some of your like social media, or do you not want to be found, or email to reach you, or any way to contact you?
I do not want to be found. If you want to contact me, you can contact me through Optimism's Peak.
Yes. So you guys know my Instagram is _Nike.Marie_. And then you also can email me at nmarie, which is, and as in Nancy, Marie, PRM@gmail.com. If you have any questions or any questions for Neka and, want to ask her anything, I talk to her every day. So I will be sure to ask her, and I'll give you guys a little a summary and answer your questions. Okay. Thanks for listening to Optimism's Peak. You guys have a good week.